we have 155 positive people who've tested positive from 4,171 samples, all tested within the last 24 hours. This therefore brings the total caseload to 4,952, and this is out of accumulative 146,537 samples so far tested. Of all the cases tested, we have 120 of them being male and 35 of them being female. The youngest is a 1-year-old infant, whereas the oldest is 77. The cases are distributed across the following counties. In Nairobi, we have 104 cases. In Busia, we have 19. In Migori, we have 10. Mombasa, 9. Uasin Gishu, 4. Kiambu, 3. Machakos, 2. Nakuru, 2. Kisumu, 1. Kajiado, 1. And in terms of sub-county distribution, in terms of the 104 from Nairobi, 20 are from Kibera. Dagoretti North has 17. Starehe has 13. Westlands has 10, Mathare 9, Langata 8, Kasarani 6, Embakasi South 4, Roysambu 4, Ruaraka 4, Kamkunji 3, Makadara 2, Embakasi East 2, Dagoretti South 1, and Embakasi West 1. And just to highlight again for you Kenyans that indeed this disease has established community transmission. And from our disaggregation today of Nairobi County, you can see each and every border in terms of Nairobi County is actually affected. And in this case, therefore, we need to really adhere to our containment measures and to escalate them individually. In terms of Busia, we have again 19 cases, and this time round again spread across Busia County with 14 from Teso South, 5 from Matayos. In Migori, 10 cases, where 6 are from Kuria West, 3 from Kuria East, 1 from Nyatike. In Mombasa, 16 cases, with 4 from Jomvu, 3 Mvita, 1 Nyali, 1 Changamwe. And in Uasin Gishu, 4 cases from Ainakoi, 2 and Tarbo 2. And in Kiambu, we have 3 cases from Kiamba, Kiambu Town, Kikuyu, each all having 1 case. In Machakos, we have 2 cases in Athi River, whereas in Nakuru, the 2 cases are in Naivasha. And in Kisumu, we have a case from Kisumu Central, and in Kajiado, we have 1 from Kajiado North. Again, we are delighted that we've discharged 102 patients, bringing our total tally of recoveries to 1,782. And we continue to thank our healthcare workers for this good job and for this achievement. Unfortunately, again, we've lost 3 more patients today succumbing to the disease, bringing our total number to 128. And we continue to highlight that it's important for those who may have any chronic conditions to really take care of their health, to ensure that they're sticking to their medication, because we continue to see that our patients that we're losing are those that have chronic conditions. And so our total number of those who've passed on comes on to 128. And to us, every death is unfortunate, and our sincere condolences to the families and friends who've lost their loved ones. And finally, we would like to emphasize on one issue that has come to our attention regarding evacuation flights, especially those coming into the country. And we've noted that some passengers on these flights are not adhering to the protocols that have been issued by the ministry. And we would like to clarify that anybody coming back home must have a COVID-free certificate from the country of origin. And before departure, airlines are expected to ensure and that it is mandatory that the passengers do fill in a declaration form indicating their preference when it comes to quarantine, and this could either be government quarantine facility or a hotel/private facility in terms of quarantine. And for those who have underlying health conditions, they must ensure that they have their local doctors who have committed in writing to the Ministry of Health to have them self-quarantined at home under their supervision. And these protocols, fellow Kenyans, are all available at the Ministry of Health's website. And it becomes necessary to really adhere to this because we do not want to get back to the beginning where we had importation of cases. And if we do not adhere to these protocols, then we risk the chance of actually importing cases into the country.